Good afternoon. My name is Karen Ripper, and I'm the President and CEO of the Council on Aging of Martin County at the Kane Center. And it is my privilege to welcome you to our first virtual 6th annual Caregiver Workshop. It's been trying times for all of us. In fact, this is the first day I think I've put on lipstick because we're usually wearing a mask. So it's been since March that we've all had to evolve ourselves and think of how we are going to better serve our seniors in this very difficult time of living with coronavirus. So it's my pleasure that Donna True and many of our sponsors were able to put this together so that we can do this virtually and help our families, caregivers, and seniors that need assistance in this very trying time. And let's be frank, anytime, whether it's COVID or not. So it's my pleasure to thank Encompass Health Rehabilitation Hospital, who is a corporate partner of the Kane Center, which a main sponsor, Addington Place, Life Care Therapy Services corporate partner, Senior Helpers corporate partner, Always Best Care, Treasure Coast Hospice, Florida Blue, and Brain Matters. This is a team effort, and I hope you enjoy and can learn from all the different segments that each of the providers will be offering during this time. So again, thank you very much for your support. We will get through this time. It's going to be a while yet, and I hope that we'll see you all again soon. Thank you.
Hi, my name's Crystal Collier. I'm the Program Director for the Council on Aging's Adult Day Club and Memory Enhancement Center at the Kane Center. The Council on Aging at the Kane Center is a 501(c) non-for-profit serving seniors in Martin County for over 45 years. So let me tell you what we do. Every day, we serve over 500 hot, healthy meals to seniors in Martin County through our Meals on Wheels program. We provide primary medical care through our Day Medical Center with our board-certified geriatrician, Dr. Sabo. We provide case management services and information and referral to over 100 seniors each week. We provide caregiver support groups, free educational events like this one with our own licensed clinical social worker, Ms. Donna True. We provide active senior classes and clubs and live entertainment through our senior center, and we provide over 300 people with adult daycare and memory enhancement services each year. We could not do all of this without our generous sponsors, donors, and volunteers. Thank you for joining us today. Please join our Adult Day Club members in the Pledge of Allegiance as we recognize those who lost their lives in 9/11. Thank you.
3. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Hi there. Ow, clear vision now. Good afternoon. My name is Donna True. I am a licensed clinical social worker here at the Council on Aging of Martin County at the Kane Center. I am here to talk to you just very briefly about our caregiver services. We have a virtual support group every first and third Wednesday. We actually have two, one in the morning and one in the afternoon. And I do a lot of one-on-one with people, especially caregivers, who need a little bit additional counseling. Feel free to call me because we can provide resources. We can tell you how to get this lovely virtual cat that the Department of Elder Affairs is providing to Florida citizens at no cost. But there's something also that we have. It's called a magic wand. Call me for resources. Donna True.
The art of letting go. Letting go is something we will all have to do at some time, for ourselves and for our loved ones. And once we let go, we can prepare ourselves to truly be together on this journey of care. Imagine I'm holding a balloon in my hand, and the balloon represents all the hopes, dreams, visions, and plans that we had for our future and for our relationship with our loved one. But it also holds our many fears, anxiety, and stress about what comes next. This balloon holds regrets and anger. It holds all the emotions that hold us back, that keep us from truly being with our loved one. When I'm holding on to this balloon, it's hard to be present. I'm overcome with fears for the future and regrets from the past. When I'm holding on to this balloon, I can't use all of my resources. My hand is tied. My heart is anxious and full of expectations for something that simply cannot be any longer. I need to let go. Once I let go, I can accept the unacceptable. I can learn to be present, and I can learn to enjoy my new friendship, my new love, my new partnership. Imagine I'm holding in my hand a friendship bracelet. The basis of love is friendship, and this friendship has no roles to play. No mother, daughter, husband, wife. This friendship has little expectations, just to be and to be loved. How do we let go of our balloon and pick up our friendship bracelet? The journey is different for everyone. It may be that you write a journal or a letter expressing your loss and your acceptance. It may be a conversation with God and relying on His strength. For others, it may be watching other caregivers and learning. For most of us, it will require practice, patience, and love. It will require us not to correct our loved ones when they say something inaccurate. It will require us to laugh when our loved one asks us something and we want to cry. It will require us to ask for and to accept help. It will require us to make the hard decisions, understanding that your loved one can't decide what's best anymore. It will require us to be their friend and do what's best, even when it means you can no longer drive anymore, you have to have an emergency alert button, you have to have a caregiver in your home, you have to go to daycare, you have to go to an assisted living facility. It means I let go of this balloon of what was and put on the friendship bracelet. I'm here with you. I'm here for you, not at my total exhaustion, but with my whole heart.
People turn to our specialized rehabilitation care for many different medical conditions. As a patient in our hospital, you're taking an important step in your journey to getting back to being more independent. Because this shared goal is unique in rehabilitation, you'll find care here to be quite different from what you've experienced in a traditional acute care hospital or other care settings. Here, you'll feel much more involved in your own care and the progress that you'll make toward your goals. We know you've made the right choice, as rehabilitation clinical research shows that patients who undergo inpatient rehabilitation following a serious illness or injury can improve their functional outcomes and quality of life. Offering a higher level of care, we can help you reach your goals with comfort, professionalism, and respect. We know you're ready to get started and probably have questions about what to expect. Rest assured, we will address any concerns you or your family may have during your visit, all the way through discharge. Speaking of discharge, you'll be glad to know we began planning for yours even before you arrived. It's important for us to know your goals and the things you feel could be barriers to your discharge plan early in your stay. You are an important part of your recovery and an active part of making progress happen. Your comfort is one of our primary concerns. Please let any of our staff know if you are in pain, hungry, thirsty, cold, warm, or uncomfortable in any way. This helps us ensure your comfort during your rehabilitation experience. When packing for your stay, be sure to include loose-fitting, comfortable clothing for easy mobility during therapies. Also, bring toiletries and any prescription items like glasses, hearing aids, or dentures. You will be provided a notebook, which is designed to answer specific questions about our hospital and your care. We call it the With Notebook, and you'll bring it with you to therapy sessions while you're with us, and take it with you at discharge to stay on track with your goals. The first step in reaching your goals is meeting members of your rehabilitation team. The team is here to guide, encourage, and inspire you towards success. Following admission into our hospital, you can expect a visit from your case manager. This is your team link, making sure your treatment plan is coordinated and you and your family are updated on your progress. This keeps everyone on track with the discharge date and discharge plans. Your team includes registered nurses who are available 24 hours a day to answer questions, manage your medical care, and help you with pain management. Remember, physicians write prescriptions for patients, so nurses can give pain medication as needed. Always tell your nurse if you are in pain. It may take up to 45 minutes for medication to work, so never wait too long to ask. Also, please know that your safety is our top priority. Until we know you are safe to move about your room alone, always ask for help when you need to move from your bed or chair. This will help you remain safe and accident-free during your stay with us. Remember, call, don't fall.
Yeah,
Oh,
I'm
there
in here,
you are.
Ronnie.
There you are. Hey, we gotta go. We have an appointment.
Where we going? Look, I put my mask on. I'm
Good.
just looking at this beautiful. Isn't she
Oh,
great?
she's great. Let me
They
see.
got married. They had it. It's
Oh,
on the
beautiful,
side of the
beautiful.
ocean.
All right,
and-
enough of that.
No, I
Listen,
really want to finish
I know.
this.
When we get back, we gotta go.
Should
Come
I?
on.
I have to go to the bathroom.
We don't have
Should
time
I
for
go?
that. We don't have time. You're gonna have to hold it. You should have gone earlier. Let's go.
Okay,
Come on.
okay.
We need to go around to this side.
No.
We got it.
No,
We got an
no.
appointment.
I'm driving the car.
We're late. We're late.
My car. I'm driving my car.
I told you.
Give
How
me
many?
the keys. Give me- I think
You
it's my car.
can't. You can't.
Oh, Nancy! I'm driving this car.
No, you cannot drive this car.
This is my car, and I'm driving
you
my
cannot
car.
drive this car.
You know
Absolutely
what?
not.
I'm not going to the doctor.
So, Mom, that probably wasn't the best interaction there. How did you feel?
Like you were getting into my space. Like you were definitely not paying attention to what I was doing. And I was feeling like you were just entering into my space, and I was feeling very frustrated, angry. Yeah, I just wasn't liking the fact that you were coming at me so fast.
And I did. And you know, it was really in that moment all about me. It really was not about you at all.
Yeah.
It was about my need to get you somewhere that we were running late for. And I did not respect or was empathetic and supportive with what you needed from me to get that ball rolling.
Right.
So.
And it wasn't a lot of time. It wasn't done. It wasn't done slowly enough for me to even comprehend what we were doing or where we were going.
Yeah.
So that was kind of difficult.
Yeah, that's fair. Let's see what happens if we try it a different way. Mom?
Yeah, Ronnie,
Hey,
what's
Mom.
up? What are you doing?
A little bit of this and that. What you doing?
I'm reading. Look, isn't she beautiful? She looks just like your sister.
Oh, yeah, she is. That's a
know.
nice dress.
I know. Look at that. Isn't that beautiful?
Did they just get married?
I don't know. I don't know when. I don't know. It looks like summertime though.
Okay.
I don't know where we are now, but it looks like summertime.
Nice. Hey, got a question for you. I have to go
Look, I have
run.
my mask on too now.
You're on top of it. I almost forgot mine today, but I wore it. I
You have to
remember.
wear them. You have to wear them.
Listen, I have to go run a few errands, and it is a beautiful day outside today.
Is it hot?
Not too hot, and there's a nice breeze, and so I thought maybe it'd be nice to get out of the house. I could use the company. You want to go take a ride?
Well, we'll be home by the news time.
Oh yeah, plenty of time. Yeah.
Okay, all right.
Oh,
let's-
good. I'm glad I could use the company. Here, let's put the magazine down there. Perfect. All right.
I don't want to lose my spot. Okay.
Yeah. Okay.
Okay.
All right.
Alrighty.
All right,
Let's
go.
go.
Coming with me. I don't want to drive alone. And isn't it a nice day?
It is. It's nice and sunny. You told me it.
It
It's sunny.
is. It is sunny. Probably gonna get a little warm later. Do me a favor. Can you hold these for me? I want to drop those off to some friends.
Okay.
Yeah, we're gonna go right over here. Watch your step. There we go.
Oh, it's the fancy car. We're gonna go in the fancy car.
Gonna go in the fancy car here. Alrighty, let's get you buckled in. You know, this makes me think of that song we used
Where
to.
are these going to?
Well, we're gonna drop them off to some friends of ours. Remember when we used to do road trips? When I was a kid?
Yeah.
What would we always sing when we were getting in the car?
Road
Again. Just can't wait to get on that road again. The life I know is making
Oh, you
music
always
with my
remember
friends.
the song.
I can't wait to get on the road again. Okay, I'll be right there. Whew. Well, that seemed to go a little bit better.
Yeah. I think when you're approached in a manner of, it says in slow, it's quiet, very methodically. It wasn't like, hey, I'm gonna go, we're gonna go. It just gave you a little time to comprehend what was happening. We had that conversation, so that kind of mellowed me out a little bit as to what was going on. And your approach was great.
Yeah, as I say, the proximity was a little bit different.
Yes.
Meaning I was more down to your eye level, and it was slower, although I'm a fast talker anyway, I know that. And one thing that struck me too is in that first interaction, I was quick to yank that magazine out of your hand. But what did I do differently this time?
You actually looked at it. We had a conversation about it, and it was you kind of came into my world a little bit, and like took me into yours as we were leaving. So that was perfect.
Yeah, trying to get you up to go with me. Two very different techniques that I used. I mean, the first one was it's very sterile, dry. We have an appointment, we're late, versus handling it a little bit differently this time. Something that's going to be worth doing. It might be enjoyable, which was
right. And I think the conversation. I think if you're going to have someone do what you want them to do, you've got to have that conversation. You've got to be comfortable with one another versus the hurried and I don't want to do what you want to do just from the get-go.
Yeah, absolutely. And it was something that I think, from your perspective, sounded like it would be an enjoyable outing, and also at the same time doing something for me, because I commented a couple times that I would really love to have the company.
Right.
So we were a lot more bonded in that moment.
Right. Again, making me feel good in your space.
Yeah.
So yeah,
right.
That was good.
Okay. Well, that's the one we want to use moving forward. Right.
Okay.
Great.
Okay, Mom, I think I got you. I see you. Hey, Mom. Woo. Mom.
What? Am I supposed to touch this button?
Oh, no, don't touch a button. Can you see me?
I see you.
You see?
Yeah, it's good.
Okay. Hey, Mom, move. I can't see you.
Is this good, Ronnie? Is this good?
Yeah, that's great. You look good. Can you see me okay?
I can see you. What are you doing?
The office. I'm trying to wrap up.
Why is this button? Why does this keep doing this?
Don't touch the buttons. The buttons. Just remember, don't touch the buttons.
All right. Okay. Go ahead.
Okay. All right. So how you doing? What'd you?
I'm good. I'm good. Your sister's calling. What are you doing? Why aren't you paying attention to me?
I'm so sorry.
You made me get in the picture. Here, I'm in the picture.
Okay. Good. Okay. So I asked what you ate today.
Cereal. I had cereal in the morning.
Okay. It's good. Did you eat all of it?
Yeah, it was good. And some eggs.
Okay. Yeah. Okay. Remember that in about an hour you got to take your medication. Okay. Don't forget, like yesterday. And I can't call you to remind you again today.
Where did you put the medicine? Where is it?
It's over there on your counter. It's Mom. I can't. Mom.
What?
Mom.
What? You told me to take the medicine.
There's no sense. Otherwise, I just call you.
Didn't you want me to take the medicine?
Yes. That's all you need. Just remember to take the medicine in like an hour. Okay. It's on the counter. Just
Okay.
Don't forget it.
Okay. All right. Okay.
All right. Okay. So
Your sister's calling. Your sister's calling.
Fine. Go ahead. Talk to her. I can talk to her. Whenever she rings, the queen must be answered. I'm gonna go. All right. Bye.
So, technology can be frustrating for any of us.
Yep.
And when you add somebody even in the early stages of dementia with it, it can really just be another challenge that throws that person for a loop. How did you feel in that first call that we had?
I mean, knowing how I work with Zoom, it was fine, but thinking about a person with dementia on the other end, looking onto a computer screen, seeing a loved one can be very confusing. And then there's the distractions.
Yeah.
And so we're all used to all of those distractions of people getting up and a dog or a cat walking across the computer, but they're not used to seeing, you know, you holding up the paper or holding up they want to focus on you. That's the only thing.
Right, and I think that's really the key. And again, you know, in the early stages of the dementia, the Zoom meetings might be quite effective, but like with so many other things, I think we have to really kind of take the cues from the person who has the dementia, because if it becomes such a frustrating experience and they can't understand where the sound's coming from or who they're looking at or what's going on, then I think it's time to change, to end it, and try to find a different format to have that kind of communication.
Right. I mean, obviously, you know, the mom wants to speak to her son. She's looking forward. She smiles when she speaks with him. But if it's going to become a frustrating encounter, then it's really not worth doing it that way.
And I, as a son, was not very attentive or engaged. I mean, a few times I started writing on a notepad or going back to my work and just kind of going through the motions.
Right. You were kind of like leaving me out in Zoom land, like
and you picked up on it because you felt, you know, kind of like in real person, you can feel isolated and disengaged, and it's not a comfortable feeling.
And again, the way we are as professionals using Zoom, we're very used to doing that. But when you're engaging with somebody with dementia, you have to engage with someone with dementia. You can't be working and doing other things. They've got to have that focus.
You brought up a good point too. I think that, you know, perhaps some people can still use Zoom or something like Zoom as their way to communicate, but it may just be as simple as taking their picture off the screen. The voice might still be fine, but then the person's not necessarily looking for where, you know, looking at that face and trying to figure out why are you in a box on this doohickey in front of me. You know?
And it gives the loved one peace of mind to see that mom's doing well. She did get up this morning. She has her clothes on. They match. She's got makeup on. She's taking care of herself. But they don't have to see you on the other end doing whatever you're doing.
And our backup always is to go with what, you know, what folks are used to and what their long-term memory is used to. So it may just be as simple as having a phone conversation if you can, because that's something that, you know, if you have dementia, even if you're an elder, you're very accustomed to talking on the phone and not having to see another person while you're doing it. So, all right, very good.
Hi, Mom.
Hi, Ronnie.
How are you?
I'm okay. I'm good. Oh, look at that. It goes from one. I'm good. Are you at the office? Where are you?
Yeah, you're right. I'm office, but I was thinking about you, and I thought I would take a break and give you a call and see how you're doing.
Oh, look at that.
Yeah, this is where I work.
I like that. It's nice and bright.
Yeah. So, you look good today.
Thank you. Opie, something's popping up on here.
You're all dressed. It's okay. Don't worry about it.
Okay.
Can you see me all right?
I can. I like your shirt.
Great. Thank you. I'm wearing my Florida State Go Noles. My Florida State shirt.
Go Noles. Yay. That was good. I like that. That was good. I liked visiting you there.
Remember back in the when we would go to the football games?
Yeah.
They were a lot better. Thankfully than they are now.
I don't know. I don't think I've seen any. We haven't been in a while.
Well, I'll tell you what. They may not have at the games this season because of this whole, But what if I come over and maybe we can catch it on TV together?
Oh, yeah. Yeah, we have the big TV now.
Stand up and cheer.
Yeah, on the big, we can put it on the big TV. Okay.
I would like that.
Okay.
Get some sandwich, maybe have some pop and just watch football.
A little beer. Just a little beer. We'll have some beer. Okay. All right.
So just a little bit now. Just a little bit.
Okay.
All right. Well, good. Listen, I do have to get back to work, but I'm going to call you in about an hour or so. I want to make sure that you have lunch and you take your afternoon pills.
Okay.
So I will call you back.
Okay? You're going to call me here, not on the phone? You're going to call me here?
Yeah, I'll call you from here. And if I can't get you, we'll figure it out.
Okay.
I'll run by the house.
Okay.
Alrighty.
Okay.
Oh, by the way, how's Esther doing?
She's good. She's good.
Oh, good.
She's doing great. She got a new job. She's going to get a car. She's good.
Oh, wow.
Yeah.
Awesome. They broke the mold when they made her.
They did.
Right?
She reminds me of my mother. Yeah.
I'm sure she does. All right, Mom, I love you. I will talk to you very soon.
Okay, Ronnie.
You have a good morning, okay?
Call me in a little while.
Bye-bye.
Okay, bye.
Oh, bye-bye.
So again, a little bit better outcome and a better experience the second time around. We live, we learn. What was different from your end?
The focus. The fact that you were asking me questions that I would then answer, and then you would come back with another one. So we were totally engaged the entire time, which kept my attention, which kept me, I know a couple of times that, you stopped, so I kind of picked up my phone, but you brought me right back to where you were. And I felt much better. It wasn't frustrating. The first call, I think, was, it ended poorly. And this, I was, okay, you're going to call me back in a little bit. I may have forgotten why you're going to call me back, but I know you're going to call me back, and that's fine.
Good. Yeah, and I think carrying it over, and it's funny, just because you have dementia, or whether you have dementia or you're not, really as human beings, we have the same needs. We want, if we're going to have an interaction, we want to be heard, we want to be engaged, we want to feel like the other party is genuinely interested in that interaction. And you picked up on the fact that I was in the office. Which was great, and I actually just took a brief second just to kind of show you a little bit of my desk area to just kind of affirm that for you. But I think also as a son, what I wanted to share with you is, yes, I'm at work, and yes, I have responsibilities, but I wanted to take a little time out because I was thinking about you, and I genuinely cared about you, and wanted to check in and see how you're doing. And I hope that as a mom, that made you feel good.
It did. And I think that just knowing that you would take the time to do that in the middle of a busy day, it means a lot. It means a lot. It's not happening at nighttime when I'm tired. It's in the middle of the day. I'm more aware. It was good.
And as somebody with early stage dementia, we still had the medication issue that we had in the first call, but I handled it a little bit differently with you, right? What was different there?
Well, you didn't say, I'm going to call you in an hour, you're going to get up, you're going to take your medicine. You just kind of mentioned that you were going to give me a call back in an hour. I don't even think you mentioned a time. I think a little bit later. So I wasn't focusing then on, oh my God, I got to take my medicine, I got to get up, I got to do this.
Yeah, and you did ask me. You said, are you going to call me this way? And I think, well, I might have said yes. I didn't want to go too far down that road and create frustration. I said, worst case scenario is I'll come over and we'll make sure you get it. So, which may or may not be an option, for some people. But I think the important thing is, rather than gum it all up with frustration and questions, we'll handle that when I call back the next time.
Don't
and see
worry,
where that
Mom.
leads
It's
us.
okay. We'll figure it out.
Yeah, absolutely.
That's good.
All right, very good. Well, we all live and learn in the pandemic. We learn new skills even with dementia. And I guess a Zoom call is the newest one to the list.
It is.
All right.
It is.
You love your mom and dad, and they've always been there for you, always taken care of you. But now they could use a hand, and sometimes more help than you can provide. Thankfully, there's Senior Helpers. Experts in Alzheimer's, dementia, and Parkinson's care. We can help you transition from a hospital stay to home, or just help your loved one with assistance with their everyday needs. Visit seniorhelpers.com to learn more. Discover why Senior Helpers is senior care, only better.
Hey guys, it's Crystal Collier, back to tell you about Life Care Therapy Services, one of our sponsors for this event. Please check out the YouTube links on Body Mechanics, brought to you by Matt Green from Life Care Therapies. Thank you.
Hi, good morning. My name is Cindy Allen, and I am the Senior Community Relations Director with Addington Place of Stuart. We are formerly Allegro Senior Living, and we have been in this community for over 9 years. And I'm pleased to say I've been with the community since it opened. Our community, independent living, assisted living, and memory care. We provide day program in our memory care for those folks that are with us overnight, and we also provide a day program for those folks that may live in assisted living and need a little bit more programming during the day. Right now in our what we call our new normal in our world, our community tests every other Tuesday with our own testing. And the Department of Health also comes in and tests on the opposite Tuesday. So we are very forward thinking. We are making sure that we practice social distancing. The one thing our independent living residents and of our whole community, 106 residents are in independent living, 65 assisted, and 24 memory care. Our independent living residents are free to come and go from our building. We do test, temperature checks daily, twice daily. Our assisted and memory care residents are dining just as they would, and so our independent living and dining is open in independent living. Assisted living are dining in their apartments at this time. We're hoping that that changes soon. We're feeling positive that the governor's going to help us out and work with us, and we invite you to call Addington Place of Stuart. We're on 3400 Southeast Astor Lane here in Stuart.
Hi, I'm Laura Kramer. I'm a licensed clinical social worker with Morse Life, and I'm here to talk to you about the tips that you need as a caregiver. In past years, I've gotten up in front of the room and talked about brand new topics, but in the interest of time, we're going to go over the top 10 that people tell me help them the most. So with a nod to David Letterman, I give you Laura's top 10 tips for caregivers. Number 10, they have a broken brain. If you can look at your loved one and assume that their brain is broken, you're not going to expect them to remember and think and do the things that they used to be able to do. Number 9, enter their world. They're going to say some pretty outlandish things like, Clark Gable is coming to pick me up for a date. Great, Mom, what would you like to wear? Is the perfect answer to that. That way there's no argument, nobody's embarrassed, and they could have a little fun with that. Number 8, guilt should be a 4-letter word. We say we feel guilty, but really I think we're just sorry about what's going on. We wish it didn't turn out that way. You're not guilty of anything, you didn't do anything wrong, and you most certainly did not cause the situation that you're in. Give yourself a break. Number 7, the 10 absolutes. If you've ever come to any of these seminars before, you've probably seen these or heard these. These are written by a fabulous woman named Jo Huey. They're available all over the internet, or let me know if you'd like a copy. I'd be glad to send them. They're a list of things that you want to try to focus on and do, and things that you want to avoid doing. Number 1 being, never argue, instead agree. Which leads me to number 6. When you can't agree, at least validate, reassure, and redirect. Think about it. If you can just tell them what they're saying is okay, you don't really have to agree with it. Let them know everything's going to be okay and change the subject as quickly as you can. Number 5, when you've seen one, you've seen one. We say that when people ask, what's going to happen next? Is my husband going to go through this just like my grandmother did? We don't know. Everybody has their own path and their own journey through this disease process. So being patient and understanding and dealing with each individual as an individual is going to be your best bet. Number 4, think about your line in the sand. When I say line in the sand, I'm thinking about the times when you're going to have to make some big decisions. What do you think you're going to be able to continue to manage as an individual caring for your loved one? When is the point when they're not going to be able to be left home alone safely? Or at what point might they do better off in a memory care facility? Some people say, oh, I could never change diapers, so that's it. Next thing they know, they're changing diapers. So your line in the sand might be concrete, or you might step right over it and keep moving forward. Now those are the top, from 10 to 4. The top 3 are a little more about you. Number 3, take care of yourself. Physically, spiritually, emotionally, mentally, financially, you've got to think about yourself. You spend so much time thinking about them. You've got to continue to care for yourself so you can be good for yourself and your own well-being, as well as being available to take care of your loved one. Number 2, join a support group. I can't say this enough. I am in awe at what I have seen go on in support groups, how people are there for one another, share with one another, make each other feel so much better about what they're going through because they're going through it as well. And if you'll notice, at the end, a lot of them end up to be wonderful, wonderful long-term friends. And the number 1 top 10 tip for caregivers is to realize that you are not alone. Do not try to be team of one. If you're playing a baseball game and you're playing all the bases and you're being the umpire and the coach, you're going to be exhausted. Think about all those wonderful resources out there. Please take advantage. The adult daycare programs are opening again, even right here at the Kane Center. Caregiver counseling is available to you. That's one of the things I can provide. Ultimately, you might need memory care. Things like the VA and Medicaid programs are available to pay for those things, and hospice somewhere along the way might be very helpful. If you need to reach me, here's where I am, and I will be back this afternoon on the panel to answer any questions. Thank you.
Treasure Coast Hospice Grief Support is provided to anyone dealing with the death of a loved one or anticipating the death of a loved one. We provide individual counseling, group counseling, family counseling, and our services are provided to children, teens, adults, the elderly, really anyone who is having a hard time with grief, we support them. One of the things that my team and I have discussed is how are we going to support the bereaved community once the social distancing and the restrictions lift? Because as we know, a lot of people have been stuck at home. They haven't been able to go visit their loved ones who may be in a hospital or a nursing home, as well as the piece that is so important when someone dies is to have that closure ritual, a funeral, a memorial service. So those things that help somebody grieve are not happening. So we really are ready to support people in probably a different way than we ever have. We know that people are really going to be struggling with complicated bereavement issues. And Treasure Coast Hospice Grief Support staff is ready and will be here for however long it takes for these people to be able to start feeling better and healing.
Good afternoon. My name is Dwan Clayton, and I am the coordinator at the Memory Disorder Clinic located at Palm Beach Neuroscience Institute. Today, I will be discussing Eye on the Diagnosis. The learning objectives for today: why get an early diagnosis, benefits of a memory assessment, and the memory assessment process. So let's dive right in. Why get an early diagnosis? It gives you access to information, resources, and support. There are a lot of community resources available for patients, caregivers, and families. Identifies and treat a potential reversible cause. Some of those reversible causes could be vitamin deficiency, thyroid, and medication issues, just to name a few. Maximizes your quality of life. Benefits from treatment. There are a lot of clinical trials that you may qualify for, and it gives you the opportunity to plan for the future. Benefits of the memory assessment. It establishes a baseline reference. So each year you can look and see if there are any declines in your memory. Just like they say, know your numbers, you should also know your memory assessment, so you should be getting one yearly. Depending upon the results, it will let you know if further evaluations are needed. And it looks at different domains of your cognitive functioning to determine if they are weak or impaired. The memory assessment process. In our clinic, we utilize the Montreal Cognitive Assessment, also known as the MOCA. It takes about 20 minutes, and it's a one-on-one private evaluation with me. The evaluation will look at learning and memory, language, general intellect, orientation, calculation, memory, and delayed recall. 20 minutes, you get your results, and at the end, I provide recommendations. So, if you're interested in getting a memory assessment, also getting the early diagnosis, Palm Beach Neuroscience Institute has 2 locations, one in West Palm Beach and the other in Boynton. And I can be reached at 561-990-2135. Thank you.
Hi, I'm Dr. Mark Brody at Brain Matters Research here at the Kane Center in beautiful Stuart. We're a nationally known research center for Alzheimer's disease, memory loss, Parkinson's disease, and we've been in the Kane Center for the past 18 months. We have a number of ongoing clinical research studies both in Alzheimer's and Parkinson's, and I'm happy to announce that we're on the verge of possibly the first breakthrough treatment for early Alzheimer's that's going to the FDA today. And we are one of the biggest groups in North America involved in this study. I'd like to tell you that all the assessments here, if you come into the Kane Center, is free. You can call for a virtual memory assessment or a video health consult, and the number is 561-381-9060. I do need to tell you I tell bad jokes. I hope you'll live through them. My latest one is this. Do you know what the German term for constipation is? Farfen poopen. Don't worry, it'll get better. Call us.
Hi again, it's Donna True. Every year at our annual caregiver workshop, we love having a caregiver who comes in and talks to other caregivers heart to heart. It's the most effective communication there is out there. Next, you're going to see a few minutes with Paul Careccia, who is a caregiver along with his wife for his father-in-law, Tom.
Hi, as Donna said, my name's Paul Careccia. I just want to say thank you for having me today. And I'd like to give a big kudos and thanks to all the people here at the Kane Center for all that they do. It's been a real blessing to me and my family to allow my father-in-law to come here for the past year or so. Let me tell you a little bit of background about why I'm here and who I take care of. My father-in-law's name is Tom. He's has been diagnosed with Lewy bodies dementia back in early 2018, but probably been going on for some time before that. My mother-in-law, for many years prior, she has passed now 6 years, and we took care of her as well. She had dementia as well. She had frontotemporal dementia. So I had a little experience before my father-in-law came to live with us. Not that I wish I had experience, but I did. And that kind of helped me in the way I care for my father-in-law now. So I just want to talk a little bit today about kind of what I do every day and maybe hopefully encourage some of you that are struggling or just, I know we struggle. It's just a hard thing. There's nothing good about it. And every day is a struggle. Every day is an experience. Every day is a new day. We never know what's going to happen. I was telling Donna the other day that we can never string 2 good days in a row. You know, we have a good day and then you hope the next day is going to be the same, and I gave up on that. And it's nice when it happens, but very rare that it does. So with my mother-in-law, let me go back a little bit. We took care of her. They lived next door to us. My father-in-law and I would take care of her for about 3 years until we couldn't do so anymore. And she ended up in a nursing facility and since passed about 6 years ago. As that happened, my father-in-law just started to go downhill, and we noticed that it was more depression than anything. He missed his best friend. It was his only friend. Him and my mother-in-law were the closest people that I've ever met, and he was lost. And it was sad, but he was eating dinner with us every day and still functioning, still driving, still taking care of himself. But we started to notice things. I started to notice things, and I told my wife, I said, something's not right. He's not driving right. I don't know, something just isn't right. So we went to see a neurologist, figuring let's start there and see what we can come up with. And immediately she kind of gave us a diagnosis of Lewy body's dementia, which I thought was kind of out there. How could you make such a statement at such an early stage? But she did. And from there, we went on to the Mayo Clinic. We got second opinions. We did everything we could to find out what exactly was going on. And we found out, in fact, that it was confirmed. That's what he had. And so we ended up selling his house and selling everything that he had. And he moved in with us. We converted our house and made it, he's got his own suite, his own bedroom and bathroom. And it's tried to make it as comfortable as we can for him. But as time is progressing, he's going downhill. And coming here at the Kane Center, we had tried to get him here for about a year. My father-in-law, if anybody knows him, is a very stubborn man. Did not want to come here, didn't even want to come and visit. And yet I kept telling my wife every day, he needs to go. We need to make this happen. So talking with Crystal and trying to make this happen, we ended up getting approval to come, and then it was just a matter of getting him here. And as many of you know, sometimes they're not willing, but I said to my wife, I said, he's not capable of making these decisions, so we're going to make it. And we're going to take him. And he was mad, and he was coming here, I'd say, for about 8 months. He didn't like it. Every day he came, I'd say, how was it today? Oh, why do I have to come here? And he would complain and argue. But I know being here is the best thing for him, just to be around other people engaging him. And whether he participates or not, it's just having that atmosphere of being around other people other than me, because I became his sole source of everything. As you know, as a caregiver, as you take care of your loved one, I know things are different. This is my father-in-law. It's not my spouse. And those of you who have spouses that you're taking care of, I'm sure it's difficult. I'm sure to watch them deteriorate is so heart-wrenching, as it is for me, but not on the same level. And yet I'm able to do what I do because I had to kind of put my feelings aside a long time ago. And I know I have to do what I have to do to take care of him. So it starts early in the morning when we get up. He's not a morning person, so now he's been getting up around 9 o'clock every day. Goes to bed around 9 o'clock. He gets a good 12 hours of sleep, but he's exhausted all day long, takes naps throughout the day. But getting him up out of bed is it's always when I knock on his door in the morning, I say, "Good morning, Dad, time to get up." It all depends on his reaction. Sometimes he just rolls over and starts to get up slowly, and other times he says, "I'm not getting up today." And boy, that's always a tough day when he says that. Just makes things harder because he's not willing to participate. And that's makes my job a lot harder, as many of you probably know. When they're not willing to help themselves and you have to help push them along, it becomes a chore. I'm exhausted, as many of you probably are. It's exhausting. I never knew, I was a dad of 2 children, but my wife took care of my kids. I worked. I wasn't doing that day-to-day feeding and changing diapers and changing and all that cleaning and washing and bathing and all that stuff. And now I'm doing that to an 82-year-old man who needs help. He can't do anything himself. So by the time I get him up in the morning, get him in the bathroom, brush his teeth, get him in the shower, wash him up. He's now starting to be incontinent, so that's becoming a big issue. And boy, that's a lot of fun, as many of you probably know. Not that I want to talk about that, but it's real. It is what it is, and what are you going to do, right? We have to take care of those things as well. So it's been rough. It doesn't seem to be getting any better. It does seem to be getting worse. And I don't know what your situation is and how you deal and how you cope coming here and being part of, part of some of the things that they offer here has been helpful to me. As a matter of fact, I came here about 1.5 years ago to one of the events, and they did skits, and I said to Donna True, I said, boy, Donna, if there ever is an opportunity, I'd love to be in a skit. I think it would be fun to be in a skit and maybe bring some humor to this. Because I've learned if we don't learn to laugh, all we have is cry. I mean, you're going to cry, as many of you probably do every day through frustration, and there's just only so much we could take. But laughter, I think, becomes a good way out. It becomes a good medicine for me. And the Bible says that laughter does good like a medicine, and I believe that to be true. It really does. And sometimes you just got to laugh. And laughing sometimes gets you over that hump or get you past that aggravation that you were experiencing at that moment. So I encourage you to find some time for yourself. I mean, I know if you've ever come here to any of the classes, they encourage you to take care of yourself. I'm a walker. I go out 5 days a week and I get my walk in, hook or crook, I do it. And I get my 3-4 miles in. I have to stay in shape because now I have to take care of him as well. So like I said, I'm not here to specifically talk to you about your situation because everybody's different, but if I could offer some encouragement to just say, one of the frustrating things for me is that he has no desire to even get up in the morning. He has no purpose every day. He has no reason to do anything for himself. I become all that to him. So I call him up to say, hey, Dad, did you start drinking your water? Yeah, I'm thinking about it. I said, well, why don't you do that now while we're on the phone? And that's it. I probably do that about 25 times a day, telling him to drink, because we've had experiences of being in the hospital many times for dehydration, as you may have experienced many physical things that for their lack of being able to help themselves. Last week was his birthday. He turned 82. My daughter and my son-in-law were here with my grandkids, and we had a little party for him. And I want to show you a little video. I mean, it's not going to take long. I'll just show you a segment of it because it's really cool to see. This was a good day for him. And I want you to see, what it... So we had dinner. My son-in-law put on some music, and if you can watch, he starts to engage in singing. This is so not him, so out of character for him. He doesn't even smile any part of the day, and he had a good day. And as many of you know, if you have a good day, if it's one day, you take it. And I'm glad we had a good day, and I'm glad it was his birthday and he was able to have a good day. And I took several videos of him singing. He even got up and danced with my wife. It was awesome. So you take those good days and you say, wow, he had a good day. And I want to close, I'm going to end this video and just show you one little picture that I took of him at the end. We had dinner and he had a cheeseburger. And part of the cheeseburger, they gave him a piece of lettuce on the side. And he ended up putting this on his head. And I got to tell you, a lot of people would think, well, he probably didn't know he was doing. No, he was well aware that he put this on his head. It was the funniest thing because he put it on his head and he looked at everybody and he kind of gave his old swagger and he went, hey, look at me. I'm funny. And boy, we laughed and he laughed. And so it was a good day. So I just want to encourage you, in your caregiving, look for those, take advantage of that one moment if you get it. And just relish it and treasure it because that's all we get. I don't know what tomorrow's going to bring. I don't know what today's going to bring when I get home and see him. But hang in there. Keep doing the work you're doing. Everybody in your family appreciates what you do. I appreciate what you do because it's a sacrifice. And keep on keeping on. Thank you so much.
Hello, my name's Stephen Snell and I'm the owner-operator of Always Best Care Senior Services. We're very proud to be a sponsor of today's event. And before I get into speaking a little bit about my company and what we do, I'd like to set the tone with a short video.
Taking care of my mother is so hard. All my life, she gave me the best care she could. Now it's my turn. I have to find my mom the best care.
At Always Best Care, our caregivers are matched to meet your needs. And we even give you access to on-call, round-the-clock physician support, along with your in-home care. If If you need help with your mom or dad, call 1-888-316-6178 or visit alwaysbestcaresouthflorida.com.
Hopefully that video gave you an idea of what it's like to be a caregiver. Whether or not you're a son, daughter, husband, wife, or the next door neighbor, somebody is going to have to step up and help with that loved one. We provide a service that assists with all those types of activities of daily living, such as bathing, dressing, toileting, grooming, continence care, and safety. We also do cleaning and homemaking types of activities. Laundry, dishes, changing the linens, reviewing a photo album is popular, transportation to appointments if you can't drive. We are a safe and trusted provider. We're a home health agency. We do not use contractors. They're all supervised employees, and they're vetted and trained, exceeding industry standards. So if you're looking for some assistance and maybe a little bit of a break, we can put together a customized care plan for you and your loved one. We service clients from Fort Pierce to Boca, and just give us a call or call and text this 888 number. Thank you very much.
We're on.
Are we live? Can anybody hear us? Hey.
They can hear us. Fantastic.
All right. Hey, we have about a half hour more. I'm Donna True, and I'm a licensed clinical social worker. We are recording live at the Kane Center in Stuart, Florida. We are socially distanced. We have Lysol. We have Lysol spray. We are good to go. We are not sharing mics. So we're very excited about that first hour of education, and now we have a half hour with panel questions. And be sure you stay tuned for our outtakes and bloopers. Don't leave us until a little after 3. As I read on the headlines today, on September 11th, 2020, and we are recording, this is a day we will never forget. And that's why we really wanted to have our club members do the Pledge of Allegiance. So we have a very quick 30 minutes for the panel. Please use the chat box for any questions. We are definitely going to keep our eye on that. At the end of this today, you'll get a survey. We're going to email it to all registrants. I want to thank our committee for all the work they put into this. We started planning as soon as the year turned to 2020. We were not expecting a COVID Corona 2020. So our vision changed a little bit, but hopefully you'll have a link next week to the entire presentation and workshop. Right now, I'm going to turn it over to Matt Green, and we'll have everybody introduce themselves. But remember, don't leave until you see the outtakes.
Good afternoon, everybody. We've got an interesting amount of questions that we're going to get to in 1 second here. My name's Matthew Green from Life Care, but I want the other panel members to introduce themselves at this time. So we'll switch the camera and start with Deb.
Good afternoon, everyone. My name is Deborah Thompson. I am the Director of Operations at Senior Helpers of the Treasure Coast. Ron is not my real son, and unfortunately he is not with us today because he is actually caregiving for his father. So thank you for coming.
Laura.
Good afternoon, everyone. I am Laura Kramer. I'm a licensed clinical social worker with Morse Life, and we have a grant that entitles me to do individual family caregiver counseling and support groups in education like this. Welcome.
And Dwan.
Good afternoon, everyone. My name is Dwan Clayton, and I am the clinic coordinator at the Memory Disorder Clinic located at Palm Beach Neuroscience Institute. Welcome, and thank you for joining us this afternoon.
Well, we're going to jump right into the questions, and Donna is going to be taking some of the questions online. We've already received some questions. This is from Jennifer. Jennifer asks, how has COVID changed the realities of caregiving? And I'll just start out just briefly and say, you must understand that the COVID, it's about risk management. There's no perfect way you can avoid the risk, but you can significantly minimize the risks. And Deb's going to start with talking about the outside caregivers and outside people coming into your home.
Yeah, so up until COVID, I've spoken to many of you caregivers that have said that you've brought in family members and nieces and grandchildren and people that are working at the church and things like that to care for your loved ones. During COVID, you want to make sure that these people are practicing the CDC guidelines for COVID. You want to make sure that they are using the proper PPE. You want to make sure that they are social distancing when they're not with your loved one. And if they are college students or whatever, you want to make sure that these people are actually tested for COVID before they're coming into your home.
I would add to that I don't think I've had an individual session or a group where that hasn't been the topic, and it unfortunately can be a dividing topic. I had a session this morning where somebody said her brother's not speaking to her because she's willing to have her son come visit from New York. So we have to be respectful, but we also have to honor our own concerns and ask other people to respect that. As far as caregiving in general, since the beginning of COVID, the true lockdown, and now things are slowly opening, a lot of resources have not been available for caregivers. Daycares were closed. People were concerned about bringing outsiders into their homes. So I have seen stress levels really, really escalate. I have seen and heard about people with dementia declining rather rapidly because they're out of their routine. They don't have access to get out of their homes. So I just ask you to please ask for help if you're in that situation. One of the things I meant to say during the top 10 tips about support groups is that we are doing them virtually. And I have about 4 or 5 of them available virtually. The groups that we usually have, general group and adult caregiver group, adult children caregiver group from the Kane Center is being available virtually. So if you can be on here now, you can be in a support group. So please look at the handouts that Donna sent you and reach out and let's get you involved in a group if you're not already.
Fantastic. We'll keep moving. From Anton, is dementia very common with Parkinson's? Dwan, excuse me.
No problem. Yes, someone that has Parkinson's does have a higher risk of developing a dementia such as Alzheimer's and diffuse Lewy body. We would say that if you do have a loved one that you're noticing some cognitive decline, as I spoke about in my earlier presentation, that would be a perfect time to get that person a memory assessment.
Laura, anything to add with your support groups?
I do have a specialty group for people with Parkinson's, and we bring in, even now, neurologists to come speak, and the pharmaceutical companies represented with different medications and options. As far as the dementia, unfortunately, because I've been doing for many, many years, I have watched many people develop a Parkinsonian dementia. The statistics say that maybe 25 or 50% get it, but I see that even more often. So you do have to be aware of that and just make sure your loved ones are safe.
This next question comes from Deborah. When is it okay to discuss end-of-life choices? Laura, why don't you start us off with
I'll start, then I'm throwing it back to you. I wasn't sure what the nature of this question was. My first instinct to answer this question would be as early as possible, when you're healthy and well and able to make your own decisions. So if you're so you right now should be talking to your loved ones about this, your healthy loved ones, your children, your spouses. You should have these things in place, and that's why I want to throw it back to Matt for his other hat, his Esquire hat, to talk about it as an attorney, what advance directives are. If the nature of the question was end of life, At what point do we talk about hospice? At what point do we think about maybe not taking medications and curative measures and whatnot? It's a very, very individual question. It can be discussed with a doctor, but even if doctors are resistant to it, you can always consult with hospice. Donna and I sat through a webinar earlier this summer where they talked about the criteria for somebody to be on hospice, primarily if their diagnosis is an Alzheimer's or a dementia. And they talked about that they're using fewer words, they're in bed more often, they are less ambulatory, they're losing weight, but probably also have some other kind of medical condition like diabetes or COPD. And that's very often the situation. So you can always reach out to your local hospice and ask for a consultation and see if your loved one's eligible. A lot of times they're eligible much, much earlier than you think, and you can get their wonderful, wonderful array of resources. But I want Matt to talk about advanced directives.
There's 3 big points about advanced directives. Do it now, do it now, do it now. My wife and I just went through this ourselves. We set up our end-of-life choices through our legal preparations that we're doing for our estate. And if you haven't done it, you need to do it now. I will tell you, there are complex questions. There are questions, even being in the healthcare business for over 30 years, that I have not addressed. You need professional help. I would say you need to have an attorney. If you don't have one, you need to get an elder law attorney who specialize in these matters. Social workers have a lot of input into these issues as well from a case management standpoint. You need to understand what the law is and the information that you need to have as you enter the medical system, how you need to advise caregivers, how you need to advise the hospital, the physicians of your choices. Because if they don't have that information, they will not use it. So it can be very complex. The sooner the better to understand it from a legal and medical perspective. The next question is from Sally. Hello, Sally, out there in Zoom land. How to deal with anger? Well, Deb, you kind of addressed a little bit of this in the video. Why don't you start?
So the first thing to do is to acknowledge it. You don't want it to disappear. You want to hit it straight in the face and just say, you know, what's going on? What can I do to help you? Let's talk about this. There's also redirecting. You can look through a photo album, look through things or do things that would bring joy. The music is a great idea. Put on some music. You know, dance around. That typically changes somebody to be a little more happy, like you saw in the video prior to this. You can also put on a television show, a comedy, something that would kind of break the ice a little bit. But there are some times when you just have to step away. And when you do, obviously make sure that your loved one is secure, but it just may be you that's making them angry and they just don't want to deal with you right then. So just step away, go into another room, walk away, go into another area of the house, or just even step away from them. Sit and read a book or whatever and see if that works. But a lot of times stepping away works better.
We got a lot of response during the caregiver presentation of the video, and the gentleman did just a heartfelt great job in presenting that. And I think to add to what Deb said, every day is different, and to be prepared for the difference. From Deb's skit, they did a great job in identifying issues. Be prepared, even practice preparing for those issues, so you have a list of things in your mind and how you're going to respond to a difficult day, a time of anger. From Ellen, how do I deal with a husband that says, it is not he that needs to be tested, but you?
Well, Donna should answer this because her favorite word is anosognosia, which technically means the inability to recognize one's own disease process. So it's not necessarily they're just being stubborn or difficult. Could be being proud, but it could be anosognosia. They don't recognize what's happening. And let's face it, for the most part, other people do recognize it first. I would say play along. Most doctors, and I know Dwan and I both worked at the Memory Disorder Center, plenty of people came in there as the guise of, I'm the one that's being tested, and we just take you to a separate room, and they think you're both being tested. I'm sure Dr. Brody over at Brain Matters, they do free tests all the time. So, hey, let's both get tested. You're right. It could be happening to me too. Let's both get tested. Don't try to shove it down their throat. And even once the person gets diagnosed, it's also important not to continue to try to convince them, but you have memory problems, don't you know? That's not going to be fun for anybody. That's when you get that anger we had in the last question. So play along, right back to the 10 tips, just validate, go with it. Yep, maybe I'm having memory problems too. Why don't we both get tested?
We're going to throw it over to Donna. Do we have any questions coming in?
I have so many questions, Matt. Oh my goodness, we need another hour. Can you guys all stay with us? An hour, maybe two? Okay, here's a good one because I've heard a lot. I've been doing telephone reassurance calls and I hear this a lot about purpose. What is the appropriate response when the person does not want to get out of bed since they have no purpose? Who wants that one?
I have to tell you that during COVID, I think it's been as difficult for caregivers, but it has been difficult, I think, for professionals as well, because we're not getting up, we're not going to work, we're not getting in our cars, we're not doing what we typically do. And I have to tell you that the fact that I can help somebody in life, but I think my grandchildren have gotten me through this a lot. I have to be honest. So you have children, you have grandchildren to be living for, and I think that has gotten me through a lot of this.
And I think the other is to create purpose. Come up with something they've got to get up to do. Make a project, have them help cook something. You need to, and think back to what's important to them. What did they do for a living, or who are the people that are important to them? Get that Zoom call. I know my mom was a little down and out, and my aunt called me, we got to do a Zoom call. We just set up a Zoom call so I can get my little grandbabies on there, and that cheers everybody up. So yes, we all need a purpose. Create a reason for them to get out of bed.
Okay, I'm going to read one more question from the chat box for right now, and then I'll turn it over to Matt. But this is one private question. My sister has Alzheimer's, just diagnosed with a urinary tract infection, UTI. After a visit to the emergency room, she's very different. Does this change after the antibiotics kick in? So much worse, like a completely different person now.
We do very often see urinary tract infections affect behavior in people who have even the smallest amount of dementia. Sometimes we don't even know they had dementia, and all of a sudden, wow. I'm glad you got that diagnosed, because there's very often I'm having that conversation when somebody's saying all of a sudden they are bouncing off the walls or lethargic or really mean and nasty when they're usually nice. Always get that UTI checked. Yes. Hello. Always get them checked. And hopefully, ideally, the antibiotics, which also can cause a little mess up, so it could take a while. Oh, there's a delay up there. That's really awkward. So with time, the person should level out. I say should. I have seen situations where an illness, a flu even, or a UTI or something, can do what I call hit the fast forward button. It can make person kind of go into that next step or that next stage. But typically what you're seeing is a temporary reaction to this disruption in their bodily system.
And I would just also add to the fact that, you know, your loved one has gone into the hospital. I'm not sure how long your loved one has stayed into the hospital, but to go into the hospital and then now to come back home. So you're dealing with a lot of different changes that go along with that UTI. And just like Laura said, over time, hopefully everything should level out.
And just a point on preventing UTI, we're seeing with the patients we serve in the homes with the isolation, a severe decrease in activity. And there's a general decline in health, which increases the chances of getting an infection. And that goes to the earlier question about what you can do to keep your loved ones mobile and active and participating in any type of activity that you can be creative with. The immobility and the lack of movement is a big contributor to that problem. From Ellen, excuse me, this is from Natasha. Do you have a specific diet to enhance the memory? And we'll throw this over to Dwan.
Yes, there is a specific diet. We recommend, and studies have found that the MIND diet, M-I-N-D, and that stands for the Mediterranean Intervention for Neurodegenerative Delay Diet. That is what we recommend in the clinic, and that is what we give out to everyone. And there's also a study that just was done by Rush University that states that incorporating these additional lifestyle changes can reduce your risk of developing Alzheimer's by 60%. And those would include no smoking, cognitive exercises, physical exercise, at least 30 minutes a day for 5 days a week. And also, and I know I enjoyed this when I read it, having 1 or 2 glasses of wine per night definitely helps out.
2 or 3?
1 or 2.
1 or 2. All right.
And we're not like a big glass either, 1 or 2.
The exercise to put with the diet is cardiovascular. Cardiovascular exercise is the most important exercise for brain health, getting the oxygen going. And if you don't know what I mean by that, talk to your local trainer or someone who knows a little bit about exercise so they can help you do the right exercises to get your heart and lungs going and get the oxygen going as well. You want cardiovascular exercise.
And Matt, let me just add something about exercise, because I think when people hear exercises, we're not talking about going to the gym and really just going at it. You can go for a nice brisk walk, 30 minutes a day. As long as you're getting your heart rate up, that is what we're talking about.
That is the key. Absolutely. I couldn't agree with you more. There's nothing better, maybe swimming. Other than that, there's nothing better than a brisk walk with a nice arm swing and a good pace to be very beneficial. From Kathleen, how can we provide support to relatives living nearby while having so many demands? Job, family, essential job, and so much more ourselves. Is there an answer? Wow, there's a lot packed into that question. Deb, what are you thinking?
As far as getting help with your loved one, obviously you can you get either a company to come in and help you with the ADLs or the activity of daily livings, which would be feeding and bathing and grooming. But you can also reach out to the virtual support groups that we're doing on a daily basis for you. Because you need the support as well. Unfortunately, this question goes both ways. So obviously for the client, we would offer to have somebody come in and help you out with those things.
Yeah, first when I read this, I thought it was how do you help somebody who's caregiving for someone else? But then we read it again and we think maybe this is how do you kind of care for somebody who lives across town, or a parent who you see them failing, but you have your own responsibilities and can't just move in and start taking care of them. So the great answer is to avail yourself of the resources, as I talked about in my tips, as Deb talked about, and some of our sponsors. But there also could be things you could do. You could pay their bills for them online, take that responsibility away, even if you live in another state. A lot of people can do that, can manage finances and kind of find the things that don't require taking your time away from other responsibilities, but can really take a load off their plate. Having groceries delivered, things like that you may not have to do physically, but you can manage and have happen on your behalf, basically, to keep your loved ones safe.
One thing you missed today with the Zoom conference is not seeing the multitude of people that are sitting beside you, that you're not alone. And we miss that. We get to look at this big screen in front of us and see many of your faces out there. We have almost 100 people participating today. You must take advantage of the resources. And Donna sent out an email to all participants with a list of all the resources, so you can use that as a tool. But reach out, talk to others, and ask for help. Donna, you've got some more questions coming in?
I have so many really good questions, but I'm going to really I'll mention a couple of them because you all can call any one of us and we'll give you some more detailed answers. But one of them was how when somebody wants to go home when they are at home and they're constantly packing up. Another one, though, is how do you get to a diagnosis of Lewy body disorder or Lewy body disease that Paul talked about? Does anybody want to hit on that really quickly? We're almost out of time, but
I'll take that one. At the Memory Disorder Clinic, I work with a wonderful doctor, Dr. Dalvey, who is a movement specialist and a Parkinson's specialist. So if you do not have a neurologist, you definitely can come into the clinic and Dr. Dalvey can assess the patient and can give that diagnosis if that patient definitely has the Lewy body disease. And the telephone number to the clinic, I'm sorry, 561-990-2135.
And just so you know, again, all those numbers are in that participant list that I sent everybody. It's a two-sided document if you print it out. Laura, you wanted to add something.
Just the going home, and I like to quote you, Donna, because you always say the greatest thing, that home may not be a physical building. Home might be a state of mind. I'll tell you, if you didn't see the last webinar that Teepa Snow presented, ask Donna or myself for a copy of it, because she really got this, that home might be that they're cold because home is a warm place, or just a feeling that they're comfortable. And the best thing to do is just to be with it. Talk about home, reminisce about home. What does home mean to them? And reassure them that where they are is okay. You don't have to convince them that this is your home. Just convince them and reassure them they are safe where they are and home is available. Home can be a concept, and just be there with them. It's all about that.
And adding to that, Laura, thank you so much. People can be living in the past, so they think they're living in the state where they grew up 80, 90 years ago. So yes, especially here in Florida, we have people and they need to go upstairs to go to bed, but we have all these little one-story homes. So home is not what we think it is, just somebody with a memory loss disorder. Matt, did you want to add something?
Well, I have to get to one of the most asked questions every year. What do I do about taking the keys away and driving?
So there are many ways that you can have them not drive, but not necessarily take away the keys. So you can disconnect the battery, you can disconnect parts of the car. My very favorite one is, we've used it actually several times since I said this last, is to have the license disappear, the physical license that's in the wallet. Because if that generation, if you didn't have your license, you didn't drive. And right now, especially with COVID, it's very difficult to get your license renewed. I know, I had to go through it. So it could take quite a while to get that license renewed, and then maybe it's forgotten. Hopefully it's forgotten.
I'll add, have someone else do it for you. So go to a doctor, have the doctor explain why it's not safe to drive. Take use of all the technology. If they are still driving, there's tons of technology now for tracking. You see the silver alerts on the highway all the time. So take advantage, if they are still driving, of the technology to do tracking. You can have it in their wallet, you can have it in the car, and so on and so forth. But when you're addressing the point where you don't want them to drive, it's not safe for them to drive, go to a doctor, go to a driving opportunity where they do assessments, and have someone else deliver the news, not yourself.
Just to wrap up on something funny, I once had a daughter say to me, I have an agreement with my girlfriend down the street, because we decided that when it comes time, there's a form you can send into the DMV saying this person is no longer safe to drive. So I have an agreement that I'm going to send it in on her mother, and she's going to send it in on my mother, so we can look them straight in the eye and say it wasn't me.
And with that, I think it's time to wrap up our panel. I'm sorry we did not get to all of your questions, but we do have a few outtakes for you. We want to end on a high note, and maybe you all need a little, oops, not that. See, you got to be flexible. A little magic in your life, right? Magic wands. Everybody needs a magic wand. So now, Adam, are we ready for some outtakes? Thank you all.
And volunteers, thank you for joining us today. This is our own Matt Green. No, he's not ours. Why do I do that? Please join our
Oh, hi there. My name is Donna True. I'm a licensed... Oh, that's a blooper. My mask got caught in my earrings.
Oh, that's funny.
Yes.
Take this off so you can hear me?
Yeah, you go ahead and take that off. And perfect. Go ahead and say who you are.
Good afternoon. My name is Dwan Clayton. Good afternoon.
Wait.
Oh.
Hello, hi, my name's Stephen Snell and I'm the owner-operator of Always Best Care Senior Services. I'd just like to take a moment to go through and set the tone for what we're going to talk about.
Gotcha.
Hello, my name's Steve